and welcome to our very first Lunch and Learn, brought to you by Gathering Place of Brazoria County, specialist in Lake Jackson with, I think it's 30 years now of experience with treating patients with dementia and similar diseases such as Parkinson's, neck pain, spinal problems, etc. And we do have many of our Gathering Place guest who are his patients, and we welcome him with us today. Thank you for joining us, Dr. Barnwell.
Thank you.
I turn it over to you.
Hi, and welcome to our Zoom Lunch and Learn. And it's, as I was mentioning earlier, something that's very commonly done at all places of learning, like medical schools and so on. So today we'll try to go over a little bit to get us a good flavor of Alzheimer's disease and some of Parkinson's disease and things that might be helpful for patients and, of course, caregivers to use. Now, I'll see about sharing the screen, and I'll show some slides. I have way more slides for the time that we have allotted, so I might be skipping through and back and forth, but I want questions to allow me to give you information on things that would be burning in the top of the mind, like what can we do to turn these diseases around? What are the available treatments that we have? What insights that may be coming down the road, and so on. So I'll work on a share screen here. Let me see if we can get this to work. And I'll click that and share. And hopefully we can see the screen. Can everyone see the screen that we're on? All right, thumbs up there. All right. So on what I'll do here, I'm not sure how large this is. Let me see if I can enlarge it, make it big. Is that something that can be seen? All right. So Alzheimer's disease is a neurodegenerative disorder. It's a condition that has many aspects to it, but the big component is something we call cognition that's impacted. And if you look on the screen, you'll see there's a term that says dementia. Now, dementia is an umbrella term which covers different aspects of cognitive decline, of which Alzheimer's is only one. But it's the largest represented form of cognitive impairment that we have. Next to it, you'll see vascular dementia, where it says 10 to 40%, dementia with Lewy body disease, and frontotemporal dementia. And you might have heard of Casey Kasem and Robin Williams, and they thought, yes, Lewy body disease was what affected them. But Alzheimer's disease is by far the most common form of cognitive impairment that we see. Now, I know many people have seen some of these slides before. I'll try to skip to some of them that are maybe poignant and can show some important aspects of this condition. Now, if you look where it says, can you see the mouse too? Okay, yeah, where it says a PET scan of a normal brain, the red that you see here represents metabolism in a normal brain. It's higher where it's more red, which means the brain is working on all cylinders, maybe 8 cylinders perhaps. And if you look over to the scan to the right of that, where you can barely see some areas of red, that may represent Alzheimer's disease. The areas in the back here, those are for vision. So it turns out vision is well preserved in Alzheimer's disease. At the very front, over here, is where we do a lot of processing, a lot of planning, a lot of judgment comes out of that area, a lot of aspects of language, especially on the left side of the brain, an area called Broca's area. Then there are temporal lobe areas that are involved. And you can see, if you look here, you see how nice and red. And over here, you can barely see the same kind of activity. So what does that tell us? It tells us that someone with Alzheimer's disease will have problems with processing information, with planning information, with expressing themselves, getting their thoughts into words, recalling what was just said. Even things like mood may be impacted because the temporal lobe has a good bit to do with that as well. Now, what doctors call the pathophysiology, I guess big words for what are the mechanics behind this thing? It's not all clear, but we do have some clues. And let's see if we can jump ahead to some of this. To some of the clues, let's go perhaps in the gene here. So I'll skip to this one, I know, because of time. So the clues are there are some genes that seem to be linked to Alzheimer's disease. And we have about 27,000 genes that make us up. These genes make up things from when we lose our hair, our eye color, to various things. And some of them, they have the structure of a gene, but we can't tell what they're doing. Now, some genes are linked to diseases. In fact, there's a gene linked to Alzheimer's disease, and it's called apolipoprotein E. So what you see here might represent DNA, and this comes out of a chromosome. And if you look here, this is the outside of a cell, and there's a nucleus. And so within the nucleus, we have the chromosomes, and we have a number of chromosomes. And within the chromosomes is this DNA. And these bases here, they make up the structure of genes. Now, in early Alzheimer's disease, typically less than 60, I don't know who decided that. I'm going to be 58 soon, and I think, young is based on your own age. Somebody who's 100 will think that 99 is young. But in early Alzheimer's disease, which is considered 30 to 60, there are some gene mutations that are linked to Alzheimer's disease. These are some different ones, one called presenilin 1, presenilin 2, but also this amyloid precursor protein. And you'll see this will be featured as well in the late form of Alzheimer's disease. That's over 60, really over 65. So in that condition, the late onset Alzheimer's disease, this gene, apolipoprotein E, is the one that's linked. Now, this gene has 3 types to it. So people ask, well, types, what does that mean? Let's say you have a car someplace. You may have a Ford, a Chevy, or a Toyota. Those are types of cars. And in this case, there are 3 types of this ApoE gene. There's a type 2, a type 3, and a type 4. Type 2 seems to help protect you against Alzheimer's. Type 3, neutral. Type 4 carries a high risk. So everyone, it's a good thing to know, if you want to know what's your ApoE status. Here is why. If you have, and you get these from your parents, by the way, you half from your mom, half from your dad. So let's say you did your genotyping, what type you have. You have a type 2 from, say, mom, or a type 3 from dad. That puts you at lower risk of Alzheimer's disease. It doesn't mean that you can't develop it, but the risk is low. If you have one of the type 4s and, say, a type 3, that puts you at about a 3-fold increased risk of developing Alzheimer's disease over the type that's a 3 and a 3, which is the baseline. If you got a 3 from your mom, and a 4 from your mom and a 4 from your dad, that increases your risk about 15 times or more that Alzheimer's disease will be coming. So you could be 5 years old. You could be 10 years old. You could be 20 years old. Your genes don't change. So those genes that you have are given from your parents. You can have type 4 and 4. Now, what if we could, knowing our, gene makeup, do something about trying to stop the progression of this disease? And that's where I think the holy grail for this condition will be. Because what happens with this condition, with this gene, as we age, we tend to see the what's called the phenotype, the manifestation of Alzheimer's disease, where certain proteins begin to build up. Now, let me see if I can scroll through here and click to the things that will be really helpful. Let's get to this one. Well, let me go back to this here. So when we have Alzheimer's disease, let's say we have this gene 4 and we know it, and what we are not yet experiencing memory loss. And we can look into our brains with scanners, and we can also get some fluid around the brain, that's called CSF, to see if we have, if this is expressing itself. Here is what we might be able to see. This thing called plaques. So what are these plaques? So these plaques are protein particles that the body can no longer clear away in the brain, in the part that we use to remember. They're also what's called tangles, and those are made up of other proteins. Now, these plaques, we have good insight now because we are able to target these plaques. So here is what happens. In the cell, this is a neuron, there are what's called transmembrane protein. So this is outside of a cell, this is inside, and we all have these proteins. And if this is a whole protein, but when it's cut here and over here, you have a part that cannot be cleared away, and it builds up this plaque, and the plaque destroys the neurons. And we are not able to remember, to think, and to learn, and do all of the things that in those parts of the brain that I showed you. So what if we can get rid of this thing? And lo and behold, there are studies that show that we can. But let me show you another slide here. This slide helps us. I was saying earlier that early on, we could see this thing show up. This is a test from fluid in the CSF at the very top. I'm not sure if you can see what I'm doing here, but where it says CSF, this A beta 42, you can have this thing develop. At the bottom axis is time, so we're getting older. At the X, this is the Y-axis, is expression of this thing called A beta. So the A beta 4240, when we are younger, so here we might be 65 years old, and here we are less than 65, and here above 65. So before we become 65 years old, before we express problems of memory, we can actually measure this thing. So all of these lines are telling us, if you were to draw a vertical line going here, up and down, and there's somebody who's supposed to come by and pick up some medicine. I'm looking to see if they've come by yet. All right. So all before this line here, we are not symptomatic. We don't have problems with memory. But we have this thing building. It's building and building. A pressure cooker? Now, my mom used to cook a lot with a pressure cooker. You'll turn on the water, the heat, and it's boiling and boiling and boiling, but not yet escaping the valve because it's not built up enough. So right here, we are asymptomatic, but yet we can measure it, this top line, this thing that says A beta 42, in the fluid that bathes the brain. Where it says the PET scan, that PET scan is an imaging test. In fact, this one was very expensive. I remember when MD Anderson offered some vouchers, $6,000 each to do this, to measure that thing right there. This is this line. And again, it's before you ever have symptoms. So all this is symptoms. This is dementia. We're getting memory loss all here. Now, this second line, this line here is the beta amyloid that you can measure on the PET scan. But look at the top one, the fluid that bathes the brain. This top line tells us we can see this thing even before we can see it on the fancy, expensive test. And guess what? Now we have a biomarker for this. A biomarker not only in the CSF, that's the fluid that bathes the brain, but in the blood. So in other words, if this builds up in the brain too much, it spills over into the blood, and we can now get a blood test to see if we have this top thing here. That's the thing that comes way before we develop the memory loss. So a decade before, 2 decades before, if we go get a blood test, we can see if we have this overexpression of this thing, the CSF A beta 42, that tells us perhaps in 10 years, you might develop Alzheimer's disease. Now, why is that good to know? Well, it turns out the newest treatments are available that can potentially clear this stuff away, this A beta 42, that thing that eventually gums up the neurons, stops them from working, and you lose your memory. Now, when I prepared these slides, we were figuring out, could that be available? And so I have some. I haven't pared down these slides to get all the way to that, but I'll try to, let me see if I can pull down. I don't have the really nice fancy ones for you. I'm going to have to look back here. So, okay. All right. This is a word slide. It's not a fancy picture slide. Now, if you look here, this thing that says, I'm not sure if anybody can see it, but it says lecanemab right here. This is a vaccine. And that vaccine, it turns out, clears away that A beta that we see that's developing in the brain. It clears it away. But it doesn't only clear it away. When it clears it away, it allows us to remember more. So look at the results of this study. So this study had 1,800 people in it. This is a study that allowed us to get this medication. And it's called Leqembi is the name that you might see. Leqembi is the everything has a brand name and then a generic name and a fancy name and so on. The Leqembi is the name that you might see all over. But I'll tell you something, a little secret about these. If you look at the last three letters of these words, you see it says MAB, that's monoclonal antibody. That's a vaccine. So whenever you look around for all these new drugs, look at the fancy name for it. And when it says MAB, it's a vaccine. And vaccines are taking over the world. And, previously we had things like polio and measles and mumps and rubella. But I could challenge folks to see someone who just has measles, mumps, rubella. You can't find it anywhere because of vaccines. So vaccines are now available to treat Alzheimer's disease. Alzheimer's disease. We have vaccines for that. And of course, we know we have vaccines for zoster. So from A to Z, vaccines are taking over the world. So look at this study. So this study had 1,800 folks participating in it, and they were given this vaccine. Now, the schedule was very intensive. They received it every 2 weeks. That's because this vaccine was under development, and there are more in the pipeline. Some vaccines we give them once a year. Some vaccines, like say tetanus, might be every 10 years. Some vaccines, like the flu shot, every year, and so on. So this one in this study was given every 2 weeks. Now that's a little intensive, but again, newer ones are coming out where it might be once a month, every 6 months. And that's where all these studies and money is really highly pouring in now and focused on giving these vaccines, more effectiveness so they can just be maybe one dose perhaps in your 40s. So in this study, with 1,800 people, what they showed was a 27% reduction in the rate of loss of memory after they were receiving this vaccine every 2 weeks for the 18 months. And they, of course, had to compare it to a placebo. The placebo is like the sugar pill. Now, what did that translate to? And by the way, because it was so good, this study was truncated. And July 7th of last year, that medication, the Leqembi, the lecanemab, was made available to everyone. It got full FDA approval July 7th of last year. So it translates to, if you can just do this, 6 months of cooking a meal, using a computer, taking your medications, paying your bills, and hopefully not being scammed by someone in some far place calling up the young, the mostly young folks and stealing our money. Oh, you can imagine how many things. So my hope, if you look at this, is that even earlier, let's go back to this diagram. So this diagram, I think, is a good one. If you draw the line here, so right here above, forward of this, let's say again, this is 65, over 65 years old. Let's say we do nothing. All this is dementia. Dementia, we're getting mild cognitive impairment. We're losing our memory. And by this point, we are really not even recognizing ourselves, all up here. Before that starts to happen, here is this thing building up in our brains, and then we can measure it in our blood. If we can give that vaccine all along here, you just do a test. Remember, this is the fluid in the brain, but we can do a biomarker in the blood, and then we can see this thing build up. We give them a vaccine, and they don't have to worry about Alzheimer's anymore. That, to me, is hopefully where we are headed. Now, okay, what are the things to worry about with this vaccine currently? A bird in the hand, and there are more studies going on. So there are two things to worry about with this medication, this vaccine. One of them is the potential for what we call microhemorrhages. So here's why that can happen. When you have something that's in the brain gumming it up, like the beta amyloid, that thing that gums up the brain, and you give a mechanism to remove it, it changes, it perturbs and disturbs the system. And the body may have issues with it. You may have some leaky blood vessels. You may have some swelling. And those are the two things you have to worry about for side effects. So small bleeds. So what happens with this current treatment is that protocol has been established to mitigate against, to surveil for the small bleeds and the swelling. So we have to have some MRIs. So the MRIs will be done, actually a total of 4 MRIs have to be done during the course of administration of this treatment for Alzheimer's disease. So you of course will have your MRI to diagnose the condition, along with all the studies that you have to do. Now, I skipped ahead a lot because I know many people probably know something about Alzheimer's disease, but usually you have to have a memory problem. Family members tell you, look, all right, you have a problem. You may not agree or disagree. You come in, you get one of our tests, like the MOCA test, or you may have the neuropsych test, or you may have some test. That's an objective measure of memory loss. Then we have to rule out many reversible causes. Is it, for instance, vitamin deficiencies? Is it an autoimmune disease like lupus? Is it so many things? So we have to first do all of that. And then we have to now get a blood test, a biomarker. And that's as easy as just going and get blood drawn. And if we see this A beta 42 show up in the blood, and of course, we know there's some memory issues, if we go get the fluid from the brain, that's the lumbar puncture, and people are a little scared about lumbar punctures, but I'll tell you this, every woman who's ever had an epidural, she's had a lumbar puncture. Of course, women are way braver than men, so women will do that and do very well. So that lumbar puncture and an epidural is to introduce some medicine to numb things, so of course the baby comes out and mom is happy and everybody's happy. But in a lumbar puncture, what we do is we just remove some of the fluid and send it off to look for this thing, the A beta 42 in the fluid that bathes the brain. So once that's done, if we have a memory problem, the blood test is positive, we get this from the CSF, Medicare will cover this thing. All right, that brings me to another part, cost. As with most of these things that are new, they cost an arm and leg and a grandchild. Luckily, I have no grandkids yet to give to them, but they are very expensive. So this medication currently, it is covered by Medicare at 80%. And if you have a secondary, it'll be the 20% will pick up. It is $26,700 a year. I know that just makes the head explode. But when we look at, there was a prior medication like this, a vaccine that came the year before, and that one, Aduhelm was the name of that one, that was $56,000 a year. That one didn't go very far. It petered out. Way too expensive. No way. This next one, $26,000 a year, is the second one in the line. Now, I think competition dropped it down. My hope is the third one will be $6,000. The fourth one, $6. Everybody can get it. I don't know, but I know usually if you have more of things around, like 2 gas stations or 3 gas stations, perhaps the cost, of course, for gas will go down because of competition. Now, of course, I wish I could control those things, but maybe market forces, who knows what does that. So anyway, it is expensive, and Medicare has decided to cover it. Now, I'm not sure how long they'll do this, but to do it all, so here's what we would need. What I said, so memory loss, someone bringing you in, having a test done, like one of those little, tests for cognition, and ruling out other causes of memory loss, getting the scans done, getting the blood work, getting the fluid. Now, we would have to enroll in the program, and this current one is 18 months, every 2 weeks. So our cancer center here, they are gearing up to do the infusion. So it's an infusion. It's given over about 45 minutes to an hour, and you would have to monitor to see you don't have an allergic reaction. And if you are dehydrated, get you some fluid to access IVs. But it's just like an infusion that folks who are familiar with cancer treatment and so on. And after, we'll make sure you're okay for a while. Then you can go home. Now, after the 4th infusion, you have to get an MRI to make sure we're not having some bleeding and the edema. Now, so what if we do have side effects, which could be the bleeding and the swelling? In the study, they were able to stop the next infusion, let that resolve, and resume. So there were no terrible outcomes in this, but you have to look for it. Now, so knowing your genotype, that's the beta 42, the ApoE3 and 4, 2, 3, 4. We have to know what our genotype is first. So the one that has 2 4s to it does have an increased risk of bleeding a little bit more than the 3 or the 4. So we would have to surveil carefully if you know your gene makeup. Now, you can actually, if you want, without going to the doctor, turns out 23andMe, 23andMe, that genealogy company, that program that lets you know, some people don't want to know if Uncle Tom or, someone was not someone. You may not want to know about your family, but but they have in there about 250 genes linked to diseases, including this one linked to Alzheimer's. So you can know your genotype without even going to see the doctor. I think it's either a cheek swab or you spit into a tube and you send it off 23andMe, and it comes back in maybe 2 or 3 weeks or so. And then, you will know. Now there are a lot of concerns about knowing things that you think may be harmful to you. For instance, if you believe, even if it may not happen, because there are people who have that gene linked to Alzheimer's disease who do not develop Alzheimer's disease. But if you know in your 40s, 30s perhaps, that you have a gene that increases your risk of Alzheimer's disease, how does it change your life? And I tell patients this. I said, look, if you think you know the hour, the minute, the second that you leave this earth, that's the time you stop living. And God didn't put us here to stop living. He put us here to live. And so we have to be aware of how it will impact us when we get this information about our genes, and whether or not it's something we want to be aware of. Is the opening that we see a train coming to us, or is it the opening of a tunnel? And so you may want some counseling before we do this. Now, if to me, if the cost can be brought down, it can be accessible in a meaningful way. Also, if the side effects can be mitigated as good as possible, that would also let me know that we're doing something that's really good. So those are two things that I would like to really see. But I know we have this talk really, but I was going to talk a lot more about Leqembi, but I also had in this talk some about fasting and how fasting can help us. So let me switch gears real quick and throw something in there that we can do without having to worry about spending $26,000 a year. So, all right, I have a couple of slides. I must go back here about diet. I did one. Let's do this one about fasting and how fasting can help us. So this is besides having the doctors to help us with the Leqembi, which is a bird in the hand for the treatment of Alzheimer's disease that can change the course. That's course modifying. So fasting and cognition and how that may be helpful. Now, of course, in the Bible, there's a fast for 40 days somewhere. Now, in those fasts, usually you sharpen things, not just the body, but also the mind. Now, one of the things that happens is that we don't eat food when we fast. We may drink, so we don't have caloric intake. If there's a limited amount of calorie intake, around, say, 12 to 48 hours of cutting back our carbs, most people on average is about 1,700 carbs a day is what we use to kind of maintain us. If we go to 1,000 or maybe a little bit lower than that, that's going to be a fast. Now, if we go strictly all the way down, it's going to be more of a fast. So what happens when we fast? When we fast, we don't have sugar around. Sugar is a primary source of fuel for the body and the brain. But if we don't have that, the body begins to break down some of our stores and produce and go into this state called glycogenolysis. Now, what does that mean? It breaks down some of our fats, our love handles. Let's forget the word. And when we do that, we produce, when we break down the lipids, we produce these things called ketones. Ketones. Now, here's the magic about ketones: beta hydroxybutyrate and acetoacetate. So I tell patients, let's say that fast twice. That'd be a tongue twister. These things are avidly taken up by the brain. They boost brain function. The analogy I give, many people know the Fast and Furious movie series. And so this guy, Vin Diesel, he's the good guy. Well, movies have good guys and bad guys. And the bad guys have the best car. And he has a jalopy that you have to push by your foot like Fred Flintstone. So anyway, the fate of the world hinges on him beating this bad guy in this car race. And so they take off, and the guy with the fancy car is just smoking him, leaving him in the dust. And as the wire, you see up ahead the finish line, they're down to the wire. And all of a sudden, he flips a switch in his little jalopy car, and this stuff nitro flies into the engine, and at the last second, he crosses the finish line, wins the race, and saves the world until the next movie. So that's nitro. Turns out our nitro ketones for the brain. Ketones. These ketones boost brain function like nothing else. They sharpen the mind, allow us to think more clearly, to remember, to process, to keep our, head where it should be. And the brain actually flips over from a glucose state to using ketones over glucose. And the reason that's important, many dementias, the brain does not use glucose well. In fact, it's starved for energy because glucose is not well utilized. And when we have little glucose, we also do certain things. This thing called BDNF, brain-derived nerve growth factor, gets upregulated. And we can repair damaged neurons. You remember I showed you that thing where the neurons are not going to do well because of the beta amyloid? It's kind of tearing it up. If we fast, we have less glucose, of course, and we produce these ketones. And these ketones now can start to help those damaged neurons start to work again. Now, here's a little image kind of to help bring it home a bit. All right. So at the very top, you see that's very blue looking slices of the brain. These are slices of the brain. This is what the brain surface projection looks like when the brain is not working well. We don't have the ketones available for it to be firing on all cylinders. Our memory is not as great. We can't process. We can't think well. Now look at the bottom, post. When you change that diet over, you see the red? The brain is on fire. It's flying. It's doing things that are unbelievable. And you can restore some of your function. The part within here is the hippocampus. But remember, not only the hippocampus was lost, the frontal part of the brain, so we can process quickly. We can use our good judgment. We can do all of the fancy things that allow us to just, be great again, hopefully. So not just relying on medications will help us through this if we can go on that fast. All right, no one wants to fast. So instead of going on a fast, how about this? It turns out there was a prescription medication that was available up to about 7 years ago. It was called Axona, A-X-O-N-A. Believe it or not, it was a smoothie. Well, smoothies, the things you can mix up with your almond milk. Go foods without faces and mothers, so almond milk. And put exotic stuff like a little bit of mango and so on. That smoothie made ketones available without fasting. So yes, we don't have to starve ourselves. But it's still a good thing to think about fasting, like a 24, 40 hour fast. But if you can get that, you can change the top part here, the brain not being too happy, to a phenomenally happy brain. Now, that product was off the market now about 7 years, and I think it's economics. Of course, if I sell something for $100 and you sell the same thing for $10, faster than the New York Minute, I go out of business because obviously nobody will buy it from me. Enter folks like Jeff Bezos. That's the Amazon guy. But you don't have to get it from him. But it is now available on Amazon if you want, but the form of it is used in weight loss as a meal substitute. It's called Keto Meal. So Keto Meal now, you can buy this at Walmart, at HEB, and again at Amazon if you want. It's a smoothie. You mix it up. It's something with no faces and mothers, perhaps some almond milk, you don't have to do that. Whatever is your du jour, and go exotic. Make it in the morning. Get a scoop, perhaps 1 or 2 scoops, and you mix that up, and you can make ketones available to your brain, and allow your brain to work more efficiently, more effectively. So your clarity of thought, your memory, and all of the things that are important can be helpful. Anyway, so just to read it real quick, I have a summary slide. I know I kind of skipped over a lot of things because I didn't talk so much about exercise and the diet, the fish in the diet, which is really important. But right now we have many people afflicted by Alzheimer's disease. We see genetics play a big role. Our lifestyle, which I didn't go into a lot, but we want to take foods out of our diet with lots of faces and mothers, but throw some of them in there a little bit, but except for fish, which is phenomenal, it turns out. But many factors can affect this condition. But we know there's some genes related to this beta amyloid. That's that protein that I mentioned. There's one called tau I didn't touch on. That's another protein and something else that we have to go, but time wouldn't permit me. And then we have these treatments. We are familiar with some of them, which are prescriptions that are easily available and so on right now. But this thing here, this lecanemab, which is that one that clears away the beta amyloid plaque, that's that expensive one that's available, but we're, hopefully the cost can come down. And I didn't talk much about how exercise is helpful, but yes, it can be very helpful when we go into the fasting state. We can repair our brain, repair the neurons, and fish is very helpful for that in terms of things. And then we can all improve ourselves and end up cutting back Alzheimer's disease. This is one slide that shows that if we could impact the condition by 2025 and knock down the amount of people who are newly developing Alzheimer's disease, by 2050, we would have 5.7 million folks less developing this condition by this time. And that's the whole hope of this disease. We want to just knock it out the ballpark. I guess is that Sammy Sosa and Mark McGuire in the home run derby. We want to get that going. So anyway, so this condition, it's a tough one to have to live with. But we are doing our best to improve quality of life and to do well. Now, I think, let me see if I could maybe exit full screen here and maybe shift over. I'm not sure what we're looking on time. I want to be, oh boy, that time is going to fly for us. All right. Didn't leave much time for Parkinson's disease. All right. What is Parkinson's disease? So these are a slide set that I have prepared. It's a complicated thing. Let me see if I can make this bigger. I'm not sure if I can. Okay. All right. So there are lots of structures you may have heard of in Parkinson's disease. There's one called the basal ganglia. That's the structure up here. And one called the substantia nigra. That's down here. This is the front part of the brain. This thing is called the brain stem. This thing is called the cerebellum. And this kind of shows you how it sits in the brain itself. Now, it turns out this structure, the substantia nigra, sends input into the basal ganglia and an area called the thalamus. And then that sends it to the brain and it comes back. But the way I explain it to try to make it make more sense is this. So Parkinson's disease is a movement problem. So we switch gears from Alzheimer's to Parkinson's. And I know I maybe cramming too much into one time, but I don't have much time. But so with Parkinson's disease, the problem is movement. And there are two major types. One, you become stiff. And two, actually three. And two, you shake a lot. And the third is a combination of both. But these structures are involved. Essentially, the one that says substantia nigra at the bottom, the neurons, they die off for reasons that are unclear. Just like in Alzheimer's disease, neurons die off. And when these neurons die off, they can't send signals to this structure called the basal ganglia and can't influence the brain to make our movements precise. So here's a simple analogy. Most folks know of the tube. That's the TV. Well, the kids these days don't know about the tube. All they know about is iPads and iPhones. But in the tube, there's an electron generator at the back. That electron generator generates electrons and shoots it on a screen up front. When the electron passes to the front, it passes through two sets of electrons, of magnetic currents. They're plates. One pulls the beam this way, and the other pulls the beam that way. So one is oriented like this, and one is oriented like this. And so if you remember the old tube, you turn it on, and it makes a noise. The first thing is a noise, and you hear it. Well, then you see fuzz, and then a picture shows up. Okay. In Parkinson's disease, our top part of the brain, called the cortex, is the electron generator. It sends signals all the way down to our muscles to make us move. And this structure refines it like that tube, like those two magnetic fields going this way and this way to make it precise. So that when you move, it's accurate, the right amount of speed, the amount of timing, so you can walk and dance like Fred Astaire or somebody good. And you can do what you want. You can eat without shaking. You can do all the fancy things. Now, it turns out that this structure here is what's affected. Now, I'll show you another slide. I'll skip to this one. So this, let me go back to the one here. So this structure down here, when you do a slice of the brain, it could look like this. This is kind of gross anatomy. Now, you see this part here? That's the part called the substantia nigra. And it's because the neurons have a dark color when they're stained. So this will be normal. And in Parkinson's disease, right here, you can see it doesn't stain as nicely because that person has Parkinson's disease. You know, partly how we figured this out came about perhaps in the 70s out west. Folks were trying to cook up these fancy things to make them higher and higher. If meth wasn't enough and cocaine wasn't enough. And so enterprising, I guess, chemists in their garages started to experiment, and they were making these new drugs to make people high. And then all of a sudden, young men, maybe in their 20s and younger and so on, started to show up in emergency rooms with Parkinson's symptoms. Now, wait a minute. You're young, and all of a sudden, one day you're good, the next day you have Parkinson's disease. And so an enterprising, set of scientists and doctors, folks much smarter than I am, with more money and time, looked at why could this be? And it turns out the drug they were using, they were making something called MPTP, had a predilection for this part and was destroying it. And lo and behold, they were making themselves into Parkinson's disease patients overnight. Now, there are a lot of stuff in this slide that I think, and for the interest of time, what I'll do, I'll just talk about what we have in terms of treatments. So the treatments for Parkinson's disease, most people are aware of. There's something called carbidopa levodopa. It turns out that's still the most effective treatment we have that replaces the dopamine in the brain. And it helps people to go from a really shaky person to someone who can stop all the shaking and really be effective. And I have many patients that can go fishing, important things in life. And also you can eat, you can do a lot of important things. Now, of course, the medicines don't always work, and there are other treatments that are available. And I don't have a slide depicting that, but there's something called DBS, deep brain stimulation. Now, that's brain surgery, and it's scary. It involves drilling some holes, 2 holes in the head, and advancing an electrode to a part of the brain that can help to stimulate it at a certain pace, and it can be very rewarding. I've had patients there who have used it, and they can now play the guitar again and various things, and get back into life. Now, the most recent treatment, turns out, is non-invasive. You don't have to drill holes in the head, but you can use ultrasound, the high energy beams, to kind of ablate certain parts of the brain and regain function. And so it's a day procedure. You go in. Dr. Bonin, actually, James Bonin, our neurosurgeon here, and many, many folks across the country, they're doing it. And so it's radio frequency ablation or high energy ultrasound ablation for Parkinson's disease. And so it can help with that. I think maybe what we'll do is just stop so that at least we have some time for questions and so on. But there are many, many things. And I don't want to, so these will just confuse things. So we can just go back to that one and leave that one up. There's one I can leave up here, perhaps this one. So, oh, yeah, there we go. So maybe we can turn it over for questions because it looks like our time is running, and I don't want to just keep talking and talking.
Yes.
But let me do this really quickly on this pathway. So what I was trying to show you earlier on, you see up top here where this, I guess it looks bluish or green right there, that represents the cortex. This would be like the electron beam going all the way down to the spinal cord and to the muscle. Now, here is the stuff where I showed you just now. It says substantia nigra and then basal ganglia. So they influence this part of the brain to make that move very precise. There's something I haven't talked to you about at all called the cerebellum that also does that. So those 2 structures, this one and this one together, will refine the movements to allow us to be precise with timing, with not too much stiffness. So we can speak, we can do all the fancy things. So treatment is targeted to this part and some treatment to this part in Parkinson's disease. Anyway, maybe we can open up for questions. So I don't keep talking.
Yes, thank you, Dr. Barnwell. Would you mind turning off your screen sharing?
Yes.
The chat. Okay. Now, I did have a couple of notes. Do you recommend genotyping for people who have a prevalence of Alzheimer's disease in their families?
Yes, the reason is this. We are on the cusp of very effective treatments, and those who know their genotype are likely to be the first in line because you know what to expect. The studies are done based on looking at these genotypes. So that's kind of a, like an early requirement. Now, it
Yes.
also can inform us as how we may want to change our lives a bit and do things
Yes.
that can allow us to minimize the expression. Remember, I talked a little bit about diet, a little bit about exercise. You don't need a doctor for that. So you can be completely a doctor without doctor and still have a great, outlook and put yourself in the best position to do well.
Thank you. You mentioned the test 23andMe that many
Yes.
people use to trace their DNA. Does that particular test specify which of the APO genes is present?
Yes, it will give you a readout. Now, if you have two of the type fours, it'll just say you have a type four. But it wouldn't give you the two together. You could have it looks really for the four. That's what they look for. But I'm sure they have that information in their database. Maybe if you can inquire somehow, but they usually tell you have the four or you don't. So, but you can have a four and a two, a four and a three, or a four and a four, or even a two and a two and two. There's a math problem in there. So they
Yeah.
don't give you all of the information, but they look to see if you have the risk, the one that carries the
And
risk.
as a doctor, can you get the same information from the spinal fluid?
Oh, well, we get that from blood. So
Just
when
from
you come
blood?
in to our office, routinely, I send off that scan so we know exactly what we have. We have either a two and a four or three and a four, but the 23andMe will tell you if you have the four itself or not. But it wouldn't say if you have a two and a four or a three and a four. But when we do our blood test, it's just serum because the white blood cells have nuclei and we send it off, just like your cheek, swell or saliva can tell us. So yes, it does give you a picture. Mhm.
Just a little bit more. Is the lecanemab vaccine readily available for everyone at this point?
Well, okay. So to qualify for it, first you have to meet the criteria of some either mild cognitive impairment, so some form of dementia if it's early on. If you have no dementia, just the blood test, insurance will not cover it, which is so strange because they want you to first have symptoms, then go. Anyway, yes, it is available if you have the money.
I understand.
$26,600.
Wow.
Other than that, Medicare currently, again, the diagnosis has to be made, meet the criteria. They cover it 80%, but it's 26,000 like $700. And then there are MRIs and lumbar punctures and these things and infusion costs. So the cost actually is it's a lot. It's a lot.
I
But
would
by the way,
love,
quickly,
love, love to hear more, excuse me, more information about the use of ultrasound for treating Parkinson's, but I am afraid
yes.
we are out of time.
Yes,
That's
I
so
know.
exciting. And
Yes.
thank you so much for joining us today. We've gotten some wonderful, wonderful information, and I look forward to seeing you again.
Yes. Thank you. And is
Thank
any other
you.
questions that I can answer quickly? Or I know the time's up.
I do not have anything
All
listed
right.
in the chat. Okay.